Okay, in this video, we're going to talk about biliary stasis, which is a thickening of the bile, which can eventually lead to gallstones and other problems. We're taking this as the next one after insulin insensitivity because insulin insensitivity is a common cause of biliary stasis. And there is a lot of research that backs natural health care. I put as much of it in as I could find. Also, I want you to know this is one way of doing things, not the only way of doing things. Lots of things work in natural health care. My goal here is to set up a kind of Dr. Seuss version of natural health care so that professionals that aren't used to it can come up with simple, practical ways to help their patients. And also, this is for professionals. If you're a layperson out there, don't self-treat. You don't know what you don't know. So please, please, please find somebody. You can email me. I'll find you somebody. Also, I talk about Zorex a lot. One of the main reasons of that is they sell only to professionals, and you can't find them on Amazon. Okay, it's a good way to discourage lay people from doing this. Symptoms of biliary stasis include itching, and that's the big one. They itch a lot. Sometimes that's the kidney, but if you're itching, you might suspect this. Pain under the right side of the rib cage. A lot of times, if you poke somebody under there, it'll hurt. Um, Varicose veins and spider veins, you might see. This can also be capillary strength, but a lot of times if you see varicose or spider veins, you might suspect that biliary stasis is going on. Dry and flaking skin. This is another big one. People with biliary stasis have trouble absorbing fats. Essential fatty acids and fat soluble vitamins A, E, D, and K. The other thing is a lot of times constipation. You've done everything right. The patient's drinking a lot of water, they're getting enough fiber, that sort of thing, and they're still constipated. Very often that's because of biliary stasis. The other thing that can cause that, of course, is hypothyroidism. And then GERD, gastric reflux. They're taking antacids and everything, and they've still got a problem with reflux. Biliary stasis can be a source of that. Symptoms can include nausea or digestive distress, especially triggered by greasy foods. If you can't stand eating greasy foods, it's because you've got absorption problems. Clay color stools can happen. Fat or grease in the stool is common. Bitter or metallic taste in the mouth might be going on. And of course, the deficiency of essential fatty acids, vitamin A, E, D, and K. Um, See a lot in pregnant women when they get itchy skin, and the medics actually have a drug for that. And also very important, this can lead to gallstones. Bile gets thicker and thicker and thicker, and then you start getting stones. Fatty liver, which can eventually, over long term, end up as cirrhosis of the liver, can also cause biliary stasis. And that can be caused by chemical exposure, too much alcohol, metabolic syndromes, eating too much sugar, and obesity. There may even be a genetic component. Generally, fatty liver is symptom free, although a lot of the patients will experience fatigue and malaise. And like I said earlier, insulin insensitivity, too much sugar in the diet, too much refined foods in the diet is a common cause of this. Insulin sensitivity can progress to serious problems with the liver and gallbladder. One study linked insulin sensitivity and sugar consumption to gallstones and even cancer. And one group of researchers even said that getting patients off of sugar can reduce the chance of biliary tract cancers and gallstones. And these are the references. I know it's hard to pick them up on a video. I can send you a copy. Fortunately, if you catch it early enough, a simple change in diet will help. One good treatment, one thing you can give these patients that'll really help is phosphatidylcholine. There are many studies that show its benefits for patients both for alcoholic and non-alcoholic fatty liver. The best research use of phosphatidylcholine is ameliorating liver damage. Artichoke extract has been used for treating liver and gallbladder problems since Roman times. It treats biliary stasis. It's also been effective for patients with digestive issues like colitis and dyspepsia. It's an antioxidant. It protects the liver. Some studies show it to lower triglycerides and cholesterol. And a lot of companies make a gallbladder product made with beets, and beets are fine. Artichoke is more extensively studied. Also, beets have oxalates, and with some patients that gives them a problem. Every once in a while, I give them the beet product, and it just doesn't sit well with them. Fenugreek will help prevent the formation of gallstones. There's an herb, Shakapidra, which means stone breaker. A lot of research shows this against kidney stones, but there is some that show it effective in the gallbladder. And of course, phosphatidylcholine. And these are the references. Once again, I can send them to you if you like. And Zorex makes a product called GB Complete, which has a base of artichoke extract along with the fenugreek and the shakapidra and phosphatidylcholine. It's a really good product. And once again, your patients can't find it on Amazon. And if you need help, contact me, paulgvarnes@gmail.com. I'm happy to help. I've got patient education material. I've been doing this for 40 years. Anything I can do for you, because I really, really believe that you are the future of healthcare. Zorex, if you start ordering from them, they will give you free shipping on your first order if you use the code PV10. Our next topic is foundational nutrition number 6, irritable bowel syndrome and small intestine bacterial overgrowth. Hope you make it.